Hi everyone, I'm Pastor Patricia and I'm here with Dr. Richard David. He's one of the doctors who goes to our church, and we're so glad that you're here today on such a busy time and season in your life.
Well, I'm glad to be here too, and I'm certainly looking forward to having conversations with you and with our group about the coronavirus and how we can cope with this at this time. Believe it or not, I'm not that busy right now. In fact, most people are staying home. They're following the rules. They're not even coming to the doctor's office. Right now, it's safe to come to the doctor's office, but certainly we're following the rules, and at a future time, it may not be safe, but right now it is.
Well, good. I say we actually have a lot of questions. I'm sure everyone who's watching this has a lot of questions, and so I'm going to ask a few. And first and foremost, I guess the most important thing, because if you are online or if you're watching on television, there's lots of different accounts of what coronavirus does. So what are the actual symptoms of coronavirus?
Well, I asked several of the physicians and some of the nurses today what they thought the symptoms were, and to say well, it depends on who you read and where you go on the internet. We haven't actually had a case in Henderson County yet, so I have not personally experienced that with a patient. But the general consensus for this is that it's a mild flu-like illness to start off with. You feel tired, you got headaches, you feel achy, you might have a little stuffy nose. Some people say that you lose your sense of taste, your sense of smell. And it takes a while for this to develop. It's not like some illnesses that hit you all of a sudden. It can actually take several days to come about. In fact, after exposure, it can be as much as 14 days before you develop symptoms. And what you've probably heard is while you're asymptomatic, you can actually spread the disease. So it's a difficult disease to diagnose because it's similar to several other diseases, particularly in East Texas right now. We have lots of allergies. And I myself am having sneezing, sore throat, a little bit of earache, sometimes a little bit achy, and I really know it's just allergies. And so I know a lot of you are probably having the same symptoms I am, and you're worried about it. But if you typically get allergies this time of year, don't forget that doesn't go away in this coronavirus. There's still allergies out there. So usually it starts kind of mild, but after maybe 4 or 5 days of developing symptoms, it can get worse and worse. If you really do have the coronavirus, you're going to end up having fever, chills, cough, and maybe chest congestion. It starts out as an upper respiratory illness and then can develop into the lungs. Like a lot of people say, well, it went to my chest. And certainly that can happen with coronavirus. And, when it happens like that, it still can be a mild disease. You can weather it out at home, but if it gets to be where you're actually getting so short of breath that you just can't function on a daily basis, particularly if you notice your lips are blue, or if you have an oxygen monitor and your oxygen's low, then you probably need help. And certainly at any point in this course of illness, if you need to talk to a physician, don't hesitate to call. Now, it's not always right to go to the office or go to the ER without making contact first, because we are trying to isolate cases. Certainly there's no other cases in Henderson County, so it's better to warn somebody that you're coming and get some instructions. They may say, if after screening you on the phone, they may say, it sounds like you could have the disease and you actually need to maybe go to the emergency room instead, where they're more equipped to handle a case like this and also keep you isolated from the rest of the patients in the offices and the clinics.
So it sounds like the big symptoms to look for, some mild flu-like symptoms, followed by a fever and then possibly a cough. And of course, if you can't breathe, seek help immediately. But the good news is, like you say, there's not any accounts yet here in Athens, correct?
That's right.
And we also are trying to be diligent at the doctor's offices. So if you have those symptoms, call ahead and don't just show up to the doctor's office. Call ahead, see where they want you to go, and then follow through with that.
Now, a lot of people are kind of fearful about going to the doctor's office. And we agree that if you're in a high-risk group, you probably shouldn't go out anywhere, not let alone the doctor's office where there might be germs. But our clinic and all the other physicians in town are offering TeleMed. And you may not know what TeleMed is, but you can call the office, make an appointment, just like you do for a regular office visit. And instead of coming into the office, the doctor will contact you with a online platform so that we can have a face-to-face, just like FaceTime or Google Duo or some of the other platforms, or Zoom. Some of those you may be familiar with that. We have one that's a particular medical platform that when you call in, we can tell you how to access that. We will send you an email or a text invite, and then you can just log on and we can talk face-to-face on the telephone, on the computer, on your tablet, on your laptop, and that's payable now. The state of Texas has relaxed the HIPAA violation rules so that we can actually have those clinical, we have this interaction over the internet, and we can actually bill it just like you would if you were in the office. So don't neglect your regular health. If you have a checkup for your blood pressure, your diabetes, your cholesterol, or even if you just have allergies, you could probably see us with TeleMed and avoid exposing yourself possibly to the community and the germs that are out in the community.
It's an awesome system you all have. And I know a lot of people have been watching the news and again, following a lot of stuff on social media, but what is why is it necessary to continue to stay at home in this time? What is that doing and how is that helping in this situation?
Well, first it helps you because you're not exposed to the germs that are out there, the COVID virus. We don't have it here in Athens, in Henderson County right now, at least a recorded test is positive, but I'm sure that there are some asymptomatic people in our community. So you're protecting yourself if you stay at home. You're not around people that are sick, just like your mama told you when you were little. Don't be around people that are sick. Second thing is you're protecting your community because you may be asymptomatic. And if you go out in the community and you touch things and you sneeze and you cough, then you're protecting your community from getting germs from you. So the fewer people that are together, the little slower this will spread. Something I saw on the internet is if you don't have any restrictions, you're typically in the time of your disease, you're going to infect maybe 3 to 4 people. But if you lower your restrictions to your interactions to say 20% of your usual interactions, then you might infect a half a person on average. So when you look at the logarithmic growth or the spread of the disease over time, if you have fewer people infected from each person that has the disease, then of course it grows a lot slower, the peak's a lot longer, and we don't have the big burden of disease that we have. So it's important to stay home to protect yourself, protect your community, and protect your physicians, your hospital community. If we have a peak of illness right away, as you've read, we're going to have trouble with hospital beds, we're going to have trouble with supporting measures, we're going to have trouble with staffing and the medical assistants, the physicians and the nurses, everybody that's taking care of you will be overworked. So what we're trying to do and what you've heard on TV is that we're trying to flatten the curve, make it be a longer, and have less, the same amount of people may get infected, but it's going to come on a longer period of time so we can handle it in our medical facilities. Now, I might tell you now, our hospital right now is half empty. We have lots of beds available. We do not have any COVID-19 cases, as we said before. So we are ready. If we do have that, we do have empty spots. We have plenty of facilities available at this time.
That's good to know, and that sounds like a lot of it. We're trying to make sure we're protecting our nurses and our doctors and our staffs of our hospitals and our doctors' offices. And so a question that I have, and I'm sure many of you watching have, is how can we best support all of you in the medical profession in this time?
Well, certainly prayer, is a good thing you can do. Pray for the medical community. And then the other thing you do is you can just follow the different recommendations that have been out there so you can do the best we can to help prevent this from being a major problem and prevent deaths. The other thing you can do is you can stay well at home and don't neglect your other health problems. So if you have an appointment coming up for a checkup, don't just skip it. Try to do it by telemedicine, do it by telephone, but maintain your own health at home. If you have an ongoing illness that needs to be monitored, continue to do that. Don't stay at home and ignore that. You can stay at home and get it through TeleMed, but try to stay healthy at home because if we have a lot of people sick with COVID-19, and then we have a lot of people that come in with diabetes or COPD or hypertension out of control that have to be hospitalized, that'll just increase our burden. So try to stay healthy at home from your medical illnesses. But but if you're a healthy person, you don't take medicine, you can also stay healthy at home by doing the normal common sense things we do. Keep your physical health good by continuing your exercise, continue to eat right, keep your spiritual health by continuing contact with God on a daily basis, perhaps even attending church services online or Bible study online, or perhaps just a daily devotion that you do at home with your family. Don't forget your mental health. A lot of us are going stir crazy. Do things that you can do to get your mental health and your mind straight by getting adequate sleep. Maybe you can do some meditation or some yoga, or maybe other things that you can do to kind of calm your anxieties, because we're all anxious at this time. So those are things you can do to stay healthy at home. If you stay healthy at home, you won't become part of the burden that we will be managing. It doesn't hurt to contact your physician and just give them a little personal message. Say, I'm rooting for you. And, just give them some encouragement, because a lot of times we get encouragement from our patients, and that helps us keep going. So it doesn't hurt for you to do that.
Well, thank you for sharing that with us. Is there anything else you'd like to add about the COVID-19 coronavirus situation?
Well, right now what I told you could change 10 minutes from now, tomorrow, next week. Just keep in contact with your physician's office. If you have questions, certainly contact your provider. If you have a question that you feel like I can help you with, my phone number is in the church directory. But I'd be happy to talk with you. Sometimes, the office is not as busy right now, and I can certainly be a good church member and be supportive of my members here by giving them some accurate education and accurate information, as far as I know, for our community.
Well, Dr. David, thank you for taking the time to come visit with us, and know that we're praying for you. We're grateful for you, and but all the other doctors and nurses, not just here from our church, but throughout the community, are doing in this situation. So we hope that you stay safe and healthy. So thank you for being here.
Thank you.